A week out since the big, beautiful tax bill was signed into law, but many question when parts of it will go into effect and how it will impact Ohioans, rural hospitals, and health coverage. Senior health correspondent Monica Robbins talks to the state's medical director for emergency medical services, who is also an emergency physician at Akron General, about her concerns.
The Kaiser Family Foundation study found Ohio could lose about $6.5 billion in rural areas over the next 10 years because of Medicaid cuts. That's why the Senate added $50 billion to the legislation, known as the Rural Health Transformation Program, to offset those cuts on states. Critics argue it's not enough. Part of the problem is rural hospitals and EMS systems are already struggling. Dr. Cunningham is the medical director that oversees the state's EMS and also sees the issues firsthand.
We have a large percentage of EMS agencies that are volunteer in our states, and our rural agencies also literally are oftentimes on a shoestring budget. And when I look at the current reimbursement for some of the things that we do, for instance, resuscitating a patient, saving a life, often doesn't cover the cost.
There may be a temporary fix. Ohio can tax providers to help pay for Medicaid and increase the federal government's match. And the state already increased rates for more Medicaid money, but the federal bill also requires states to lower taxes to 3.5% by 2032. Until then, Dr. Cunningham says communities will have to step up support, but that's another concern.
It's not something that's sustainable now, and I'm worried that it's probably going to exacerbate that challenge. I think the communities that have the most need have the less resources to support their agencies.
She says we've already seen the results of limited care in rural communities.
It was probably 10 years ago we did a study on stroke care. At that time there was one county in Ohio that didn't even have a hospital in it. So you can imagine with time-critical diagnoses, which include acute heart attacks, stroke, and trauma, that if you exceed that window, you're going to have devastating results or possibly death. So to move a rural hospital that can at least initiate care before you can get to a tertiary care center is frightening.
In bigger cities, EMS departments have the funds to try and prevent future readmissions.
We have a new model, it's called community paramedicine, where paramedics will follow patients who are recently discharged from the hospital to try and recognize things that can be where an intervention would prevent readmission. And the cost of a community paramedicine program is certainly less than having a patient be readmitted. But right now, we don't have funding for community paramedicine in many areas of the country.
As an emergency medicine doctor, she also treats a lot of Medicaid patients and hopes people understand who they are.
The majority of those people who came had jobs, but they worked in jobs where they were underinsured or uninsured. But they're making choices of, do I go to the doctor or do I pay my light bill?
Monica Robbins, 3 News.
Monica, thank you. Medicaid cuts could hit clinics hard, especially those serving large numbers of low-income patients with no clear way to recover the costs. The community may be asked to help in the months and years ahead.